Hi, Dr. Mallow. Thank you so much for taking the time to meet with us here at MD Newsline. Please introduce yourself to our audience.
Of course, I'm thrilled to be here. I'm Dr. Beth Malow. I'm a professor of neurology and pediatrics at Vanderbilt University Medical Center, and I'm a sleep specialist. I'm also a science communicator and advocate.
Yeah, so I'm really interested to just hear a little bit about some of the things that drew you into this sleep specialty aspect of your work, first and foremost. And then we're going to talk a little bit about what you'll be talking about at the conference today, which is climate change and how that impacts brain health.
Sure. Well, I got interested in sleep when I was at the National Institutes of Health. I was doing an epilepsy and EEG fellowship, and I was really impressed by how, when
Mhm.
you impact sleep, you impact someone's entire health. So, in particular, people with epilepsy, their seizures got better when we treated their sleep disorders, those kinds of things. And then I realized that was also relevant to dementia and autism and various other areas of neurology.
Yeah, fascinating. I'm interested. Were there any insights that jumped out at you when you think about why sleep impacts those things at all?
I think of sleep as resetting our brains.
Mm.
And we all know how we feel when we haven't slept well. Some of us may be feeling that way at this meeting right now. We're grumpy, we're grouchy, we need it, we need our coffee, we're apt to send that email we may regret later. When we sleep, our brains reset, our kids' brains reset, our patients' brains reset. So we're able to control our emotions better. And people have actually shown this with imaging studies like functional MRI studies that the amygdala is activated when we're sleep deprived, and the connections between the prefrontal cortex and the amygdala are weakened when we're sleep deprived.
Mhm.
So it's just a great way to improve not just our health, but how we feel.
Mhm. It makes me wonder, is this really ultimately comes down to a sensitivity to stimulation? When we think about, let's say, neurodivergent people, for instance, there's a great sensitivity both, to uh, food. There's a lot of gut issues sometimes related to, but then there's also this like outside sensory stuff. And I'm wondering if that just kind of makes people more resilient to stimulation potentially.
Yeah, I think that's one theory
Yeah.
that we're oversensitive and that's worsened by sleep. The other that I've seen is I've seen a lot of kids with autism or other neurodiverse conditions tell me that they can't turn their brains off, or their parents will say that. Or as they get older, they'll express that. So it's almost this hyper connectiveness and this inability to kind of calm your brain. And that's what sleep oftentimes does for us.
Interesting. And what types of interventions did you see helping with that turning the brain off?
Yeah, so we always start with looking for medical conditions, looking not just at things like sleep apnea, leg movements, seizures. We also look at the medicine somebody may be taking for anxiety, depression, because those could be very stimulating.
Mm.
And then we always start with behavioral approaches. So making sure there's a calm bedtime routine, that the screens are off, because you get both that activating blue light from your screens plus the content
Mhm.
of the screens, and the news that we read right now can be very stimulating. And then we look at making sure that we limit caffeine, we increase exercise, those kinds of things. And then occasionally we do use medicines. I always start with looking for medical conditions and behavioral approaches first, though.
Talk to me a little bit about how you came to this work about the environment and how that might impact brain health.
I came to it actually because I had done a lot of advocacy with disabilities and autism
Mm.
and talked to our Congress people and all those various things. And I wanted to find an area that I could advocate for. And between taking science communication classes through
Mm.
the Alan Alda Center for Communicating Science in New York, I started doing that during COVID because I wanted to become a better science communicator. And then just seeing what was going on in the world with climate and global warming, I decided that I would try to advocate for that area. There's actually a connection with autism. I'm going to be talking about it on Wednesday, that we do see an increased risk of autism when kids are exposed to air pollution and particulate matter in the first year of life. And that may be one of the reasons that autism rates are increasing.
Yeah, I really want to dive into that. Just from a public health background, I know that I think I saw that some of the pollutants can cross the blood-brain barrier. So,
Correct.
how did we even kind of identify what these pollutants were and what they were doing?
Well, we know it's called PM 2.5 if anyone wants to look it up, and it's pollutants or particulates that are, think about soot, think about inhaling this into your lungs. That's where a lot of the work has been done with asthma, COPD. However, people have now realized they also can cross the blood brain barrier and you can have stroke or dementia, or I said that increased risk for autism. People are linking, for example, the pollutants to one of the 10 modifiable causes for stroke. So they're playing a big role. We don't know why yet. I mean, there's a lot of research that needs to be done. People are invoking, for example, neuroinflammation, or the idea that you can have epigenetic changes going on. So that's a huge area of increased research. But we definitely have seen studies that have shown that there is a correlation and relationship between exposure to this particulates and the development of brain disease.
That's There was recently a study that was published in JAMA about pollution and birth weight, and how there's a correlation between low birth weight in areas where there's high pollution, factories, things like that. I believe in Chicago. I'll have to look that up. I'm wondering, what are some of the ways that you think that people can work across specialties? Because what I'm finding is we have conversations with specialists is everyone kind of talks about the same things and we're doing our studies, but I feel like now the door and the need is opening up for interdisciplinary insights and things. I'm wondering if you have a vision of what could be done to accelerate that.
Absolutely. Well, a couple of things come to mind. One is there is something called the Medical Consortium, and it's all these different medical societies. AAN isn't in it yet. We hope they will eventually be. Many different neurological dermatology, I'm sorry, not neurological, but medical. So dermatology, cardiology, various other conditions, various other subspecialties are involved. So that's one way that you can bring everyone together and say, what are you studying in asthma? And is it applicable to stroke, for example? I'm also representing the American Academy of Neurology on the European Academy of Neurology's Task Force on Environment. And that's been fascinating because one of our key priorities is to get these research areas understood better. So it may be stroke, it may be dementia, it may be autism. How do you understand what research priorities there are that would span all the different neurologic conditions? And then I think your point about even go beyond that to cardiology, dermatology, any other field, so that we can all share our resources and share our knowledge going forward.
What other elements in the environment outside of those types of pollutants, for instance, are there other pollutants that have been identified that are the main culprits? And where do they come from? Are they all kind of soot and just regular pollution based? I'm thinking of things like runoff from the agricultural industry. I'm thinking of, clothing and microplastics, of course, but
Yes.
also my brain just goes to like dyes and chemicals used to just kind of create some of the things that are so close to our bodies. I'm wondering if there's anything that's jumped out in the research to you that's particularly interesting.
Yeah. So, I mean, there are other pollutants like nitrogen dioxide can play a role, ozone can play a role. The plastics are huge, even though we don't necessarily associate that with climate change. We certainly see these studies now with these microplastics that are getting into our bodies and causing inflammation and various other things. So there really are a lot of different uh, pollutants, I guess, is an overarching term that we can use that deserve further study.
Mm. I saw you mention somewhere about extreme heat
hmm
exposure. Tell me a little bit more
hmm
about that.
Yes. So when I think about climate change, I think about two elements that are major. One are these particulates and related other compounds that I mentioned The other would be the extreme heat from global warming. And this can be uh, synergistic in a way, multiplicative in terms of harm. So, for example, you can have one issue is you can have increased uh, the increased you get them into the aerosolization from the heat. Another of these particles, another big area would be infectious diseases, right? So, different viruses, bacteria can multiply quicker when it's hotter. You also have migration from the extreme heat, people leaving different areas and going to areas where maybe you just had animals and plants, and now you have humans in those areas. And that can contribute to new infectious diseases. And then sleep, which is one of my specialty areas, is huge. The idea that extreme heat can make a big difference in terms, if you don't have the air conditioning and all, can make a huge difference in terms of your ability to sleep, because we need it to be cool to trigger sleep. Your ability to exercise. If it's really hot, you're not going to go out in 100-degree weather. You shouldn't go out. And that's going to interfere with sleep. And then I see some young athletes with narcolepsy and other conditions who are taking stimulants for their neurologic condition, and they're not able to thermoregulate normally. So they can get into really severe problems with heat stroke if they, if you have extreme heat. So yeah, extreme heat I think is as important to talk about as the particulates.
There's so much information when it comes to patients advocating for themselves, learning about how to keep themselves safe as environments change, for instance. What are some of the gaps that you see in patient education from either from any angle, be it the community side, the provider side? Where do you see room for improvement?
Yeah. Well, one area is to touch on the extreme heat that you mentioned. I feel like there's certain neurological conditions that are particularly susceptible. So people with dementia are going to be less aware sometimes that they need to be really careful if it's really hot outside, because they could be subjected to heat stroke, or the medicines that elderly people are taking, the medicines that our young athletes are taking if they have conditions like narcolepsy. We have to watch out that they're not going to be more susceptible to heat stroke due to these medications. So that's one area. The other, I would say, are the particulates, the air pollution that I mentioned from burning fossil fuels. Even natural gas creates some of these particulates, and what that can do is that can contribute to dementia, stroke, other neurologic conditions, autism. So I think those are the areas, and it can be very simple. It could be explaining to a parent or an adult patient that, hey, maybe you should look into an induction stove for cooking rather than natural gas, or maybe you should look into getting a heat pump rather than using a wood burning stove. Very simple things like that that will help our environment and also help our patients.
I have to say, no one's ever asked me about my environment during an intake at a hospital. I wonder if that's something that we need to start, including. Um, I'm,
Yes.
yeah, definitely, for sure. I'm wondering how you might see technology play a role in this work in the future. Do you have any thoughts on where you think technology can enhance things like data collection or even advocacy or education?
I think that's a great question. I honestly have not thought about that. What comes to mind, though, would be if we could just have a profile of someone based on their, I don't know, with AI maybe, what are their habits? What have they purchased for their home? Do we see areas for an improvement based on their environment? I mentioned, for example, the induction stove versus the gas stove, different things like that, that we can make a difference. Could we track the same way that we track activity with wearables? Could we track temperature? I know some people have actually done this study in sleep where they've looked at how somebody's temperature has been, and they've shown that their sleep is affected when it's hotter. So those are all things that I think maybe we can use technology and AI to create individualized, personalized profiles for people, and then we can recommend some mitigation for them. It's a great question.
Yeah, I've thought about that kind of profile aspect, and my next thought is, how do we share information across institutions? Um, um,
Yes.
what needs to happen from an infrastructure perspective? Even me with my own personal medical records, trying to get like a second or third opinion on something, there's an entire process depending on where you're going. I'm wondering, in an ideal world, is what are some of the biggest red tape that we'd have to cross to get institutions to share information?
Yeah, and I wonder if it's gonna be institutions or if it's gonna be, our
Private.
phones.
Yeah.
And what can we do without even going through the institutions to empower the
Mhm.
patients? The patients could put their meds in if I mean, a lot of this is people are suspicious, rightfully so, of sharing their protected health information. I just wonder if we could somehow find some ways that we could share that in a way that it would really benefit people and it would improve their health.
Yeah. When it comes to prioritization, when you're advocating for climate change and things, what are the things that you see just from your experience that we should really kind of lock in on and focus if we were to say, okay, this is on our top priority list?
Yeah. Well, the first thing I'll say is we need everybody doing it. Everybody who's willing to do it. And that's why I say to people, it's not what I think you should do, it's what you want to do. And if you are a busy healthcare professional, let's say a doctor, and all you can do is talk to your patients about simple things they can do to avoid extreme heat or minimize their exposure to particulates, do it. That's huge. Do it. If you have the bandwidth, for example, let's say you're an educator and you love teaching medical students or residents or fellows. Well, get involved in education. Add climate into your curriculum for education. Write boards questions for your society. Get involved in these medical society consortiums and meet cardiologists and dermatologists and others who are interested in climate. If you, like me, love to talk with legislators and advocate on Capitol Hill or in your state legislature, there's a huge need for that too. And a lot of climate people don't think is bipartisan, but it actually is, especially remembering that if we link it to health, people care about health. Uh, our patients, our legislators still consider doctors to be trusted messengers. We have a lot we can do. It's definitely in our lane. And rather than talking about climate, we can talk about pollution, and people listen to that. And it makes a huge difference if there are health aspects. So if that's your cup of tea, I realize it's not everybody's cup of tea, but if you really enjoy that, there are groups you can join, like Citizens Climate Lobby, like the Medical Consortium. There's a lot of different groups out there. And one of the things we're going to try to do this week, we have a course Monday, and then I'm doing a plenary Wednesday, is we put together a sheet for people where it's kind of one-stop shopping. What do I love to do? What am I interested in doing? And what's one action that I can take right now to make a difference?
That's a great tool. I would actually really love to take a look at that. When I think about the impact of things like pollutants and environment, I think about generations in the past. So, generations in the past have dealt with Agent Orange, for instance. It almost feels like each generation has its own thing where, like, that's actually pretty bad. Let's not do that. Um, what do you think is at risk for our generation or future generations if we don't address some of these? climate focused brain
Yeah.
risks?
Well, I think the biggest risk for our
Mm,
generation is in the wildfires, the floods, the rising seas, all of that, and those play a role as well. I mean, certainly mental health
mm,
is affected if you've been the victim of a wildfire or a flood or another condition. And I don't want to make it sound like every wildfire and every flood is directly caused by climate change. However, we know that because of the global warming, that makes it drier and makes it easier for fires to start or be perpetuated. And similarly for flooding, hurricanes, those extreme weather events because of the increased warmth in the environment. So to me, that's an area that we can link to health and we can impact with legislators or with education, with our communities, our neighbors, our family, our friends, and we can make a huge difference. And I think that's really how I like to go about it, because to me, that's the biggest threat. Is even if we get these particulates out of our atmosphere, we have to deal with the increased global warming that has already exceeded the set points that we wanted to stay within.
mm. Yeah, I'm thinking about what you mentioned earlier about epigenetics and the what is essentially the compounding effects. I hear about epigenetics every conference I go to, from breast cancer to dermatology. Everyone's always talking about epigenetics, and now we have these new chemicals. It's one thing to have epigenetic changes due to like stress or due to famine or things like that. It's another to have changes induced by a chemical potentially. Um, I wonder if you have any thoughts about the compounding effects of all this. Not to be dramatic, but it feels like there's a lot going on at the same time that seems to be really impacting us in almost like a cascading way. What's your outlook on the future when it comes to that? It doesn't have to be doom or gloom either. Just,
Right, right, right. Well, I always look at this as an opportunity. That's just my mindset. I look at this, the climate challenge is an opportunity in so many different ways. For example, you identified something I had never thought of before, which is bringing different groups of healthcare professionals together and crossing our subspecialties, because sometimes we get siloed. I'm a neurologist. I'm a sleep doctor. I'm a dementia doctor. I'm a stroke doctor. And the idea that we really try to look at this climate climate change as a way to kind of bridge our silos, and then even go beyond that to other subspecialties. So I think that's a huge opportunity, because then we can use that in other fields as well. So we can understand, for example, epigenetics better or neuroinflammation better. I think the other big piece is in my advocacy work. When I'm not a doctor, I do a lot with bringing people together across political divides and partisan divides. I'm part of a group called Braver Angels. And I feel like it's part and parcel of this work, because what we're really doing is we're saying, let's put aside what political affiliation we have or whatever. Let's focus on health, the health of the American public, and how can we do that in a way that actually strengthens our democracy rather than fragments it? And that's why I always encourage people to talk as doctors and healthcare professionals about public health, about the health of the American people. And I feel like that's a way forward right now through some of the political messiness that we're all experiencing.
I think that the environment can teach us a lot about creating ecosystems. Uh,
Yes.
so one of the things that I have found, just thinking about what you said about silos, for instance, is that there are a lot of silos within specialties, especially just if from a patient perspective, for instance. Um, it almost doesn't feel practical to ask doctors to spend more time thinking across fields and trying to find these insights? What is missing in the ecosystem?
Right,
Uh,
right. So I think what's missing is it's not that we should ask every doctor to do all of these things. I think we should ask every doctor to think if there's any one easy thing that they're capable of doing. I remember 20, 30 years ago, I was taking care of young children and trying to grow my sleep division. And I did not have the time to advocate, right, for with legislators, but maybe I would have had the time to incorporate into my notes or my discussion with my patients something about mitigating some of these risks, like I mentioned with the wood burning stoves or whatever, or the extreme heat. So I think everybody needs to do what they can. And then I really do believe that there is a role for science communicators. So, for example, I have not done research in climate change. I've done a paper on climate change communication and how we can become better communicators with our neighbors and all. I have not researched neuroinflammation, epigenetics, dementia, all of that. But I can still talk about it and I can still communicate about it. And I think we need to support science communication and health communication in our neurology community and also in any medical community, because that we can be the connectors between the scientists and the doctors, and we can also be advocates, and we can be the ones to go talk on Capitol Hill to our Congress people about this work. So I don't think people have to do it all. I think if you try to ask them to do it all, we'll turn them off because they can't necessarily do that. They don't have the interest, they don't have the bandwidth, they don't have the time. But some of us can do that, and we should do that. And that should be promotions committees should recognize that as an important skill. The idea of doing media interviews on these topics should be recognized. So that's one of my big areas that I really believe in is pushing this forward within neurology, the importance of advocacy and science communication.
well, that is a great note for us to end on. Is there anything that you are extremely passionate about that we have not covered in this
You know,
conversation?
you've really covered everything very well. I mean, the only other area I would say, and I don't know if you want to include it in your, you can decide, is I think people are feeling a little bit discouraged right now with everything that's going on, and I think it's important to keep hope alive. One of the things that I plan to do in my talks is activate people like, yes, we have this risk of stroke, we have this risk of dementia, we have this risk of autism, we have this risk of these new infectious diseases. Yet there is always hope. And how can we transform this into an opportunity and think about ways that we can accelerate our field, accelerate science, and work together to make our patients healthier? I think that we can't lose sight of that. We have to keep our eye on the ball, and we have to remember that this is totally in our lane as healthcare professionals, and that people trust us regardless of where they are in the political spectrum. People trust their doctors, and that's really big right now.
Excellent. Thank you so much. It's been a pleasure chatting with you.